Why is toxicological testing important in drug and chemical development? Toxicological testing is crucial because it ensures that new pharmaceuticals and agrochemicals are safe before reaching the market. For example, screening helps detect harmful effects that could harm humans, farm animals, or even the environment. If a new drug causes severe side effects in animal models, it can be re-evaluated or banned before causing public harm, as seen with some pesticides and veterinary drugs in history. What are the main objectives of toxicity testing in veterinary science? The main goals are to identify adverse health effects of xenobiotics, foreign chemicals, and to understand the mechanisms behind these effects. For example, toxicity testing determines safe dosage for veterinary drugs in food-producing animals, ensuring drug residues in milk or meat do not exceed safe limits for human consumption. It also aids in establishing acceptable daily intake, ADI, levels. Who plays a pivotal role in animal toxicity testing laboratories? Veterinarians are central to toxicity testing. Legally, they oversee animal health, advise on proper in vivo models, and ensure alternatives are considered. 3 R's principle: replacement, reduction, refinement. In both Europe and the US, regulations require a trained veterinary surgeon's involvement, like being a member of IACUC in the US, to safeguard welfare and scientific rigor. What are the 3 R's in laboratory animal toxicology, and why are they important? The 3 R's stand for replacement, reduction, and refinement. They guide ethical animal use. Replacement. Use alternatives to animal models, such as cell cultures, when possible. Reduction. Minimize the number of animals needed. Refinement. Improve techniques and housing to minimize suffering. For example, telemetric biosensors and MRI scans reduce animal distress and provide more humane endpoints in research. Which animal species are most commonly used in toxicological testing, and why? Rodents, rats, mice, rabbits, and occasionally guinea pigs and hamsters are common due to their well-understood biology and cost-effectiveness. For instance, rats are preferred for reproductive and carcinogenicity studies, while rabbits are used for skin irritation tests because of their sensitive skin. Non-human primates are rarely used due to cost and ethical concerns, but can be vital for studying drug metabolism relevant to humans. How do animal welfare laws impact toxicological testing procedures? Animal welfare acts, such as the U.S. Animal Welfare Act and the European Directive 2010/63/EU, enforce standards for laboratory animal care. They require explicit plans for handling animal distress, promote humane endpoints, and mandate analgesia or euthanasia when suffering occurs. These laws improve ethical standards and public trust in research. What are some non-invasive methods used to monitor laboratory animals during toxicity studies? Technologies like MRI, magnetic resonance imaging, nuclear magnetic resonance spectroscopy, and telemetric biosensors allow continuous, non-invasive monitoring of physiological and biochemical parameters. For example, biosensors can track heart rate and temperature in rodents, reducing handling stress and providing better animal welfare. Why is the route of administration important in animal toxicity studies? The route, oral, inhalation, dermal, parenteral, affects how a toxicant is absorbed, metabolized, and eliminated. For example, oral exposure mimics foodborne risks, while inhalation simulates industrial accidents. Parenteral routes are used when full absorption is required, such as intravenous injection for drugs with poor oral bioavailability. How do species differences impact toxicological test results? Species metabolize chemicals differently, affecting toxicity outcomes. For instance, cats are highly sensitive to paracetamol because they lack certain detoxifying enzymes, while ruminants are less affected by organophosphates due to microbial breakdown in the rumen. Thus, selecting an appropriate species is vital for relevant results. What are the main endpoints assessed in reproductive toxicity tests? Reproductive toxicity tests examine both male and female reproductive health. For females, tract morphology, ovum properties, estrous cycle, uterine condition, and maternal behavior. For males, sperm count, motility, DNA integrity, and hormonal balance. Multi-generation studies, especially in rodents, reveal effects across lifespans. What is developmental toxicity testing, and which models are preferred? Developmental toxicity tests assess risks to embryos and fetuses, focusing on malformations, teratogenicity, growth delays, and mortality. Rats and rabbits are commonly used, as each species may detect unique effects. For example, some teratogens are identified only when using both rats and rabbits, improving detection accuracy. How are cutaneous, skin, toxicities evaluated in vivo? Cutaneous toxicity tests monitor for skin irritation, allergic reactions, and systemic toxicity. Albino rabbits were traditionally used for acute irritation due to sensitive skin, but now albino rats and guinea pigs are also used. Minipigs are chosen for chronic studies, as their skin is physiologically similar to humans. What methods are used for in vivo genotoxicity testing? Genotoxicity tests detect DNA and chromosomal damage. The host-mediated assay uses rodents injected with microorganisms, while the rodent bone marrow micronucleus test is popular for its ease and ability to identify chromosome breaks. The mouse spot test can detect gene mutations by observing coat color changes after in utero exposure. How are carcinogenicity studies performed in animal models? Carcinogenicity studies typically use rodents over 2 years, exposing them to various doses and monitoring for tumor development. Results include clinical chemistry, gross and microscopic examination of over 40 organs. Dogs are rarely used due to cost and their susceptibility to specific chemicals, making results less generalizable. Why are hens sometimes preferred over rodents for certain neurotoxicity tests? Hens are more sensitive to organophosphate-induced delayed neuropathy, OPIDN, than rodents. OPIDN protocols in hens involve repeated dosing and measurement of enzymes like acetylcholinesterase, along with behavioral and histopathological assessments, making them valuable for studying delayed neurotoxicity. How is immunotoxicity assessed in vivo? Immunotoxicity tests look for direct or indirect effects of chemicals on the immune system. Mice are favored due to similarity with humans in immune function. Endpoints include changes in organ weights, blood cell counts, antibody production, and responses to infections. For example, chlorpyrifos exposure in rats affects T-cell signaling and immune balance. What role do transgenic animals play in toxicity testing? Transgenic animals, especially mice and rats with human genes, for example, for metabolizing enzymes, are invaluable for mechanistic and genotoxicity studies. For example, the Muta mouse and Big Blue models can detect mutation rates after exposure to toxins like aflatoxin B1, providing faster and more relevant data for human risk assessment. What are some limitations of using animals in toxicological testing? Limitations include species differences in metabolism, cost, time, and ethical concerns. Results from inbred strains may not reflect broader genetic diversity. Moreover, animal studies are labor-intensive, and results may not always predict human responses, leading to a push for validated in vitro alternatives. What are permanent and primary cell lines in vitro toxicity testing? Permanent cell lines, like HeLa3T3, can divide indefinitely and are used for high-throughput toxicity screening, but may differ genetically from the original tissue. Primary cultures come directly from tissues, retaining more of the original characteristics, but are short-lived and heterogeneous. Both types are valuable in different contexts. How can endpoints be measured in vitro toxicity assays? In vitro endpoints include cell viability, for example, trypsin blue exclusion, metabolic activity, for example, ATP levels, LDH release, growth and proliferation, for example, colony formation, DNA synthesis, morphology, and specific protein or gene expression. For example, a decrease in ATP indicates cell death, while altered gene expression, via RT-PCR or microarray, can reveal early toxic effects.